How does Trientine effectively treat Wilson's disease? Imagine a tiny molecule that can help clear out dangerous excess copper from your body. That's what Trientine does for people with Wilson's disease. It acts as a copper chelating agent, which means it binds tightly to copper ions floating freely in the bloodstream. Once bound, these copper complexes become water-soluble, allowing your kidneys to excrete them through urine. This process is essential because Wilson's disease causes a genetic mutation that impairs the body's ability to get rid of copper properly. The mutation affects the ATP7B gene, which normally helps transport copper into bile for elimination. When this process is disrupted, copper builds up mainly in the liver and brain, leading to damage in these organs. Trientine specifically targets the excess copper that has accumulated in the body. It is a selective copper, Roman II chelator, meaning it prefers to bind to the copper ions that are causing harm. By removing this excess copper, Trientine helps prevent further damage to the liver, which is often the first organ affected, and reduces neurological symptoms that can develop as copper deposits spread to the brain. This is especially important because copper overload can cause liver inflammation, fibrosis, and even cirrhosis, which increases the risk of liver cancer over time. People with Wilson's disease often start treatment with other medications, but if they cannot tolerate penicillamine, another chelating agent, Trientine becomes a valuable alternative. It works by reducing the amount of free copper in the body, which helps prevent ongoing liver injury and neurological deterioration. Since the condition is lifelong, patients need regular blood tests to monitor copper levels and check for potential side effects like anemia or neurological changes. While Trientine effectively lowers copper levels, it does not cure Wilson's disease. Patients must continue treatment indefinitely to keep copper levels in check. It is generally well tolerated, but some individuals might experience side effects that requiring medical attention. Compared to other treatments, Trientine is often preferred for those who experience adverse reactions to penicillamine. Although research continues into other agents that might improve neurological outcomes, Trientine remains a key part of managing copper overload. In summary, Trientine's power lies in its ability to bind excess copper and help the body eliminate it safely. This reduces the risk of ongoing liver damage, neurological symptoms, and complications like liver cirrhosis or even liver cancer caused by chronic copper buildup. However, ongoing medical supervision is essential to ensure the treatment is effective and safe. If you or someone you know has Wilson's disease, it's important to work closely with healthcare professionals to tailor the best treatment plan and keep copper levels balanced for long-term health.